Thanks for joining us. This is news from the state. Today we start off in Gombe State, where the Federal Competition and Consumer Protection Commission is raising awareness about the dangers of adulterated products and harmful practices. This is as regulatory agencies prepare for increased enforcement against harmful food practices. Lanre Adeyemi has his details.
Congenital diseases, deformed babies, and even cancers. These are some of the byproducts and impacts of use of adulterated products, according to experts. The Federal Competition and Consumer Protection Commission says that this enlightenment campaign is being carried out across the country before a firm enforcement of the law. Just as the saying, to be forewarned is to be forearmed. Different types of trade groups and market associations are represented here, and addressing them are experts from different regulatory agencies. The message is direct. Stop harmful practices. Do not adulterate or sell adulterated products.
It can cause cancer. It can lead to a massive death of a population of consumers. So it is not good. Even the person who thinks he or she will ripen these things with carbide, the person is not even free. If you think it's only consumers.
To educate people from the grassroots so that to know the danger of taking this palm oil, adulterated palm oil, contaminated meat, and this type of forceful ripening of fruit. So we are going to produce so many jingles in our local languages.
Adulteration and forced ripening of fruits have long been a challenge, with NAFDAC and EFCC carrying out regular enforcement activities. Experts are clear. This is beyond economic sabotage, but a public health emergency.
Food Safety Standards Agency of India, they have banned calcium carbide. Just like National Agency for Food and Drug Administration and Control have banned use of calcium carbide in forced ripening of fruits. And even World Health Organization banned it.
These harmful practices by unscrupulous traders are simply murder by proxy. Now that enlightenment has been robust, the hope is that enforcement would be thorough. Lanre Adeyemi, TVC News, Gombe.
Now, senior reporter Lanre Adeyemi is in Gombe and is joining me on news from the state. Lanre, the FCCPC and NAFDAC have described adulteration and harmful food practices as not just economic sabotage, but a public health emergency. What more do we know about this renewed push for consumer safety?
Thank you, Ibrahim. It's interesting that the teaching hospital here in Gombe is released some figures recently saying that the rate of cancer patients that they've started receiving in the last 5 years has almost tripled. And that does not commiserate with the population expansion. The population has grown by probably less than 10% in the last 2 years. So why is cancer, record of cancers and other deformities in babies, including congenital diseases, more regular or more frequent? And they're tracing it to harmful products, harmful consumption of food products. So we can trace this and link the nexus together. So NAFDAC and the FCPC, they are all coming together, all these federal agencies, to raise awareness, to tell people about the harmful effects of these chemicals that are added to food. You can take note that many times when seasonal fruits come out, mangoes, oranges, and co, sometimes they even get ripened out of season. And people wonder, how can mango that is supposed to come out maybe during the rainy season be available readily during dry season? It's because of what the unscrupulous traders do. They use carbide and calcium to ripen these fruits out of season, and this becomes carcinogenic and harmful, both to the consumers of this food and those even who handle these chemicals. They even go as far as using formalin, which is used to embalm dead bodies, to preserve food and also to preserve grains. So it's really an harmful product and harmful practice, if I may say. And the federal government, through these agencies, are saying that this has to stop. The EFCC have also been enforcing the law, saying that this is beyond just economic sabotage, but also a health hazard. So all the agencies of government, from the health and the enforcement and the security agencies, are coming together to stop this. Because when it comes to lives, every hand must be on deck.
It's good to see that they're doing all things to ensure that they keep people's lives are safe. Thank you so much, Lanra DME, senior reporter. Thank you.